The rectum. This begins as a continuation of the sigmoid colon at S3 and it terminates as the anal canal. It's 1 inch below and in front of the tip of the coccyx. Its end is dilated to form the rectal ampulla and its length is about 5 inches. It has anterior-posterior curves which are 2 in number. They are the sacral curve which is posterior and the perineal curve which is anterior. And it has lateral curves which are 3 in number. The upper curve is convex and to the right, the middle is convex to the left, the lower curve is convex to the right. The peritoneal covering on the upper third is only on the front and on the sides, forming pararectal fossa, while on the middle 1/3 it's only anteriorly present and in the lower 1/3 it's absent. In males, it forms a rectovesical pouch, and in females it forms the rectouterine pouch of Douglas. Posteriorly, the rectum is in contact with the sacrum and the coccyx, and the piriformis, coccygeus, levator zanii muscles, sacral plexus, and the sympathetic trunks, while anteriorly in the male, the upper 2/3 of the rectum is covered by peritoneum and is related to the sigmoid colon and the small intestine, the ileum, while the lower 1/3 of the rectum is devoid of peritoneum and is related to the posterior surface of the bladder, the seminal vesicles, prostate, and the termination of the vas deferens, while in the female, the upper 2/3 of the rectum is similarly related to the pouch of Douglas and its contents, which are sigmoid colon and the coils of ileum, and the lower 1/3, which is devoid of peritoneum, is related to the posterior surface of the vagina. The supports of the rectum. First and mostly, the puborectal sling of the levator ani. Secondly, the reflection of the pelvic fascia and the peritoneum. Thirdly, the Waldeyer fascia and lateral ligaments of the rectum. The pelvic rectal and ischiorectal fat. The blood supply is from the median sacral artery, which is a branch of abdominal aorta, superior rectal artery, which is a continuation of the inferior mesenteric artery, the middle rectal artery, which is from the anterior division of the internal iliac artery, the inferior rectal artery, which is from the internal pudendal artery, and the inferior gluteal artery from the internal iliac artery. The venous drainage into the superior rectal vein and then into the portal vein, the middle rectal vein, which drains into the internal iliac vein, the inferior rectal vein into the internal pudendal vein, and the median sacral vein into the left common iliac vein. The lymphatic drainage, there is an intramural plexus which drains the submucosal and intramuscular areas, and extramural plexus. The upper half drains into the left common iliac lymph nodes and pararectal lymph nodes, the middle half into the internal iliac lymph nodes, and the lower part above the anal valves into the internal iliac lymph nodes and below the anal valves into the superficial inguinal lymph nodes. The nerve supply, the sympathetics, is through the sympathetic plexus from L1, L2, and the parasympathetics from the inferior hypogastric plexus, which is S2, 3, and 4.